Hey guys, welcome back to my channel. This is Regina with Reggisvsgcloset. I just kind of wanted to pop in. This hopefully is going to be a really quick video. This is the second to last video for our weight loss surgery related content for January. And I just kind of wanted to pop in and talk about chewing. So recently I've really kind of sat down and evaluated with myself some things that maybe I backtracked to since my major hitting major weight loss goals and stuff throughout my post-op time after surgery. And one thing I realized is that I've kind of backtracked and gone back to my old way of chewing, or lack of chewing. And I would just say that chewing is really important as a bariatric patient, especially I want to say week 3 or 4, when you start to do soft foods. Of course you want them soft, but if it's soft things, even if it's chicken, I know chicken thighs was something that was allowed, I believe, from what I remember. They want you to puree it. That's the puree stage. I could not puree, so I obsessively chewed. I chewed pretty much until the food was pureed in my mouth, and then I would slowly swallow. And even when I got back to regular foods, or moved to soft foods from puree and back to regular foods, in the beginning I was afraid of everything. I was afraid that something was going to hit my stomach and it was going to feel terrible. So I was really I was an over chewer is kind of what I called it. But recently I realized that I've gone back to my old way of chewing, or again, lack of chewing. I'll chew 2 or 3 or maybe 4 times and then I'm swallowing food, which is not really chewing. So I've been looking all over Google Play to find a really good app that I could use to help me with chewing. There are some out there. If you weren't aware, there are apps that help you chew. So I found this one called Healthy Chew. If you see it, it's the new app right here. And this is kind of what it looks like. You kind of choose which level you want to chew at. So beginner is considered 15 seconds per chew. I guess this is in a different language. Medium, 30 seconds per chew, and recommended is 45 seconds by chewing. So I've been doing the 45 seconds. You pretty much click start meal and it starts this little timer that basically is 45 seconds, and you chew until it makes a full circle. As you can see, you chew until it makes a full circle, and then once it gets to the full circle, it's another few seconds of you swallowing and then preparing your fork for the next bite. So I'm kind of just going back to this to kind of take me back to my basics, because again, chewing is absolutely important. If you chew like I normally chew, just by the time you feel that you're full, it's going to be too late and you've overeaten. And that's kind of what I've been doing lately. So I'm back to, again, the basics of using an app to help me just kind of stay on track in that sense. There is a really good video that's on YouTube that I will link down below that kind of explains the chewing process for bariatric patients and why it's important to chew. So I'll definitely link that below. But just chew is the most important thing. You know, and you forget, I forgot, at least I feel like I forgot, food actually tastes decent as long as you're seasoning it right. So chewing allows you to actually taste your food and not just feel the texture and then you're swallowing. You actually get to taste the flavors and the seasonings and everything, and it's a lot more satisfying when you actually taste your food versus just chewing and swallowing and trying to rush to the next bite. So hopefully this is helpful just keep in mind, if you are pre-op, keep in mind chewing is going to be very, very important. So maybe download an app now to help you kind of switch to that chewing properly lifestyle, and you know, just drinking slowly, chewing slowly, all of that, because you want things to be as small as possible so when it gets down in your new stomach it will digest properly and not have a hard time digesting. So that's just kind of it. I just kind of wanted to pop in again and go over how important chewing is. That video that I'm going to link is going to be really, really helpful, so make sure you check that out. Please like, comment, and subscribe. We're almost done. I don't know what my next video is going to be about. I have a few topics, or my last video for weight loss surgery related content for January. I have a few topics. I'm not sure yet which one I'm going to do. There's one I really want to do, so hopefully it like works out the way that I want it to. We'll see. But again, please like, comment, and subscribe. I love you guys very much, and I'll catch y'all in the next one. Bye!